Hang tight, Robina. We will give you your full time once we're back.
Can you hear me now?
Yes.
Hello, hello. Oh, fantastic. Thank you. Thank you so very much. It's Robina Sewell. I'm the Executive Director of California Safe Schools. And I want to thank you very much for the opportunity to comment both in writing and provide a short verbal comment today on the OEHHA Synthetic Turf Study report. We greatly respect and appreciate the significant time and effort and extensive details contributed by staff and the OEHHA scientific panel in preparing the report. The report indicates 35 fields were studied with the focus of risks from tire crumb rubber. Given the wide variation in materials, age, maintenance, and usage of artificial turf across California, the limited focus on tire crumb rubber appears to be insufficient to represent the broader landscape and variability of all chemicals in artificial turf installations statewide and their health impacts. We'd like to see a comprehensive health and safety assessment with real-time biomonitoring of individuals actively using the synthetic turf fields under normal playing conditions. The current conclusions of health impacts in the report appear to have been determined by the responses of 1,069 participants who completed online or in-person surveys, designated staff observing and noting 40 videotaped soccer players during 5 practices and 5 games, and 35 field studies, and artificial biofluid studies, which is a wonderful first step, but not the same as real-time biomonitoring. We hope that future research will evaluate all potential pathways, including not only tire crumb, but synthetic turf fibers, backing materials, and infill materials, all which may contribute to health risk. Without full chemical exposure biomonitoring data, the health risk analysis remains limited and speculative. And given the limitations identified and the time frame that these studies were performed in 2015, California Safe Schools respectfully and strongly urges OEHHA to call for a precautionary moratorium on installation of new synthetic turf fields until full, comprehensive, peer-reviewed health and environmental risk assessments, including biomonitoring of active users, are completed. The health and safety of our children, athletes, community, and public deserve the highest protection. And again, thank you to OEHHA for this report. Thank you.
Thank you, Ms. Sewell. Do we have any other public comments? I guess
I do not see any raised hands.
Yeah, we should keep the line open until 2:45. Yeah. Yeah. So moving on, our next discussion is the final panel discussion and comments. So we've been giving our overall comments along the way. Any big thoughts, Dr. Bennett?
I've kind of given most of my thoughts.
That's fine. Dr. McCone, any sort of overriding comments?
No, just I guess it's a thought that we've probably brought up and discussed, but I think the real challenge in trying to do all this is there is an expectation that that people want quick answers, and it's very difficult. I mean, this is not. It's just the nature of of the issue that you can't throw together a team, you can't throw together protocols and measurements and deploy them within months. And as you brought out early, Dr. Baums, it took longer for a number of factors, including the pandemic. But it is, I mean, a broader thought is how do we deploy, or how does an agency like OEHHA deploy a rapid response? And I'm not sure they can, but it's something I think we all need to think about, is when communities have a concern. I mean, a similar issue that I've been involved with, but also is the same kind of problem as Aliso Canyon, right? Where communities really need answers, and it's just putting together the team and the equipment and the protocols just takes years, and I don't know if we can get around that. And I'm sure there are many others that we have experience with. So that's kind of something that bothers me at some level, is the failure of the environmental health sciences community to engage in a little more rapid response, because our problem is we want to get it right, and if you do a rapid response, you usually get it wrong, and that doesn't serve anyone well. So it's kind of rambling, but I think that's what this and a number of other issues bring up.
Thank you, Dr. McCone. Dr. Eckel, any last comments?
So I just wanted to reiterate that I really enjoyed this experience being on this panel. I thought it was a well-conducted study. I did want to think more broadly. This study was narrow and it was focused on the chemical exposures from the crumb rubber, but you had some really interesting data on temperature, and I know that will be of interest to folks in the future. And I think I don't know, I didn't look in all the appendices, but if you could include the data, like a plot of the ambient temperature versus the surface temperature, that could be useful to people in the future, because I think that will be of growing concern. Thank you very much.
And before I ask Dr. Kyle for her final comments, I just would echo what you just said about the heat. That is, in some ways, the most striking thing in the report for me. Dr. Kyle.
Thank you. I also have enjoyed this and appreciate the creativity that OEHHA brought to this in doing some things that we don't usually do. And I'm not sure we've drawn the full lessons from those yet. I think we will. And I appreciate that, because sometimes we aren't creative and we do the same thing we did the last time. I think about this from a little broader point of view, in that, I think we're in somewhat of a crisis with toxics, because we're not able to keep up generally with the identification of toxic materials and substances, characterization, testing, listing, all those things that OEHHA does and other entities like EPA do too. We're not keeping up with changes in use or anything. We're still in many ways in 1990. And so some of the methods and explorations you did here, I think, could be informative to ways to catch up. And so that's one reason I want to look into some of these things somewhat. But Dr. McCone, going to raise this. We don't have a rapid response capability. I think it's more than that. We don't have a range of methods that we can use to do something rather than nothing, instead of the perfect thing. And I'm working a lot on PFAS now, and we just got last year the mega reviews of 2 of the legacy PFAS that were supposedly phased out 20 years ago. And now we have the long major review that they can use to set a drinking water standard. Okay, and then what about the 800 other ones? We're nowhere on most of that. We don't have standards for most of those things. And this is an endemic problem that we're not keeping up. So how do we deal with that? And like I said, I think you all were creative in trying to do some new things, and there are things to learn from that. And that's kind of what my next thought is. Thank you.
Thank you for those comments. Yeah, and I guess I would just say that while I just expressed my sort of frustration about how long it took, on the other hand, I agree with Dr. Kyle. This is a state agency report that actually was innovative and looked at both exposures and potential toxicity of the exposures in creative ways, as she said. So I'm not in any way trying to devalue what you've done. It's our job to, look at it, especially how it translates for future work and to the public. And I think we've done that. And I'll ask Dr. Bennett for her last comment.
I just had one more thought that it's kind of related to the not being able to keep up and the rapid response thing. And I mean, I think partly a lot of the problem is a lot of the compounds that we're concerned about, we're exposed to every day. And so it's hard to tease out how much came from this event that happened or the fields. And then if we go all the way and look at biomonitoring, you've still got, you can't differentiate out what was already there versus what's new from the event. And the fact that we're not keeping up to have measurement techniques to look at all the new things to see if maybe there is something new that came from some event that happened or particular exposure. And then again, understanding how those go into the body and what the changes in concentration are. So it's just all very challenging. And I do feel like you guys did the absolute best that you could with the techniques and methods that we have available.
And I guess I would say that in addition, one of the main reasons we can't keep up is that new chemicals and new uses of the chemicals are being put forward on almost a daily basis, certainly a frequent basis. And yeah, I think Dr. Kyle would probably agree with me. We need to go upstream and assess exposures and toxicity before there's wide market use of something. I mean, foam rubber use was supported by the EPA because it was a good use of good way to recycle tires, which when they're in a big dump, they catch on fire and they burn for months. So, yeah, I mean, Europe has done a little bit better than we have, with their REACH efforts. But we really need to be looking at toxicity, before widespread market use, which we're a long way from in this country. I think Mr. Avil has a comment or two.
So I just have one other consideration. I look at this in some ways, I look at the report in two parts. One in terms of the science, which is excellent. It was diverse, it was creative, it thought about a lot of these pieces. Many different groups contributed to it and all should be thanked and, is an accomplished piece of work. And I think about how this is going to be used and how it's described and contextualized. And so on that second point, I would just say, clearly I don't want to put words in your mouth, but from my perspective, in 2014, 2013, there was a lot of concern about the use of crumb rubber on these fields. And that was the focus. And so it makes, contextual complete sense that we systematically went to understand what it was in that rubber, which was not meant to be used for children's fields, but rather for car tires and truck tires and so forth, to see if there were any health concerns. So I think that's completely legitimate. Now that we've looked at that and we understand that, maybe if we could rewind and go back and say, well, there's also the plastic fibers, there's also the cushioning material. There are several components to this, but clearly the crumb rubber was, sort of the red flag in our face that we're trying to understand, in addition to the paints and the coverings and so forth on the material. So I don't think you need to be particularly defensive about, focusing on the rubber. But I think again, in the report, in the summary and the description, maybe in the introduction or rationale for why the study is conducted the way it was, I think it'd be appropriate to say something that, crumb rubber is widely and generally used in all this and was not made for the specific purpose. And so from a public health standpoint, it was an important question to ask because of the potential for exposure.
I think if the panel's finished with final comments, I'll turn the mic over to Dr. Edwards.
Thanks, John. All right, so just wanted to really thank the committee. Really appreciate all the thoughtful comments from today. I thought the discussion was excellent, and we really do appreciate the feedback around the the draft report and sort of broadly where we can go in the future. Just to kind of summarize some of the main actions that I heard. I think from the afternoon discussion to, and also from the morning from Dr. Bennett's comments around sort of the time activity relationships, really look at those factors. I guess my quotes here or my notes is the soccer is life youth, where there is a strong soccer component to their everyday activities. That we can kind of look at and see where the values come from that compared to what we had done. The sort of second piece around, and this is just a broader categorization, but within the limitations and the uncertainties, to really be able to highlight and provide context into some of the areas a little bit more that maybe that we had not looked at before, to kind of see if we could tease out a little bit on the first year effects a little bit more. And then also to maybe look at heat, if there's any inferences we can make on the evaluation of the temperatures a little bit more throughout the report. The last item is sort of to kind of go back and have that sort of revisit component to really look at the chemicals that we initially started looking at. This gets to Dr. Kyle's comments. And to be able to maybe talk about why they weren't conducted, and sort of so that there is an expansion of the discussion to have a broader awareness of these gaps and of what was not evaluated during this study. As for next steps on this report, we're going to be taking into consideration the oral comments that we received today, the panel member comments, any written comments that we've also received, updating the current draft, and finalizing later this year. So we're excited to get to a sort of closure on this work. A couple of, just to go off of Dr. Kyle's comments around the sort of we're behind a bit, just sort of stay tuned. We had a couple of workshops last year. It's what Dr. Krishnan is leading, a group at OEHHA, just started a couple years ago, surrounding computational toxicology and new approach methodologies, sort of really looking, instead of trying to identify everything with animal studies or an epi study, to be able to leverage existing information that does have those types of studies, to looking at chemical analogs and so forth from not only a scientific and technical perspective, but also the ability to use in a regulatory construct. So I think the behindness part could maybe sort of try to, through this, can hopefully maybe be able to get on par or catch up to some extent. But I did want to highlight that to this group so that you're aware that we are starting this work, and in the next couple of years, hope to have something out in the near future.
I'm glad to hear that, Dave, because in the academic world, that's already been going on for a few years, as I'm sure Dr. Christian knows. But it's good to see OEHHA getting there, getting up to speed.
Dr. Bonds, if I might, just for a second. And it's not just you, everyone is behind. I didn't want that to sound like it was OEHA, and I listened into some of those workshops, and there's some great stuff there. So,
And I would just say, this state is blessed to have OEHHA. Most states don't have anything like this agency.
So are we just waiting for 4 more minutes? Okay. 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 All right. So this is going to be last call for any anyone that wants to have a public comment go on the record? Well, I don't see anything in the room, and we're not seeing anything online. All right, so with that, I will go ahead and adjourn the meeting. Once again, thank you for everyone that attended online and in person and the panel. Thank you.